Okay, breast augmentation is what I've been asked to talk about. It's the most commonly performed cosmetic procedure done by plastic surgeons in the country, in this country, and across the world. In terms of choosing the patient, the patient needs to hear all the pros and cons of all these things that have to do with surgical procedures like breast augmentation, and have the information available to them to decide whether they want to do it or not. The operation itself is a not greatly complicated operation by itself, but as far as surgeries go, but it is complicated by the fact that we're using this foreign material that's made out of silicone that we think is safe. It's been used for many years, but the amount of scar tissue that forms around these implants when they're placed inside the body is up in the air, and we don't have all the control over that we, both the doctors and the patients, wish we did. So the patient needs to know some of the more complicated things, the type of complications that can occur after any surgical procedure such as this, and I think they're best treated by just having that information available to them to help them decide whether they want to do something like this or not. The surgery itself is usually performed under general anesthesia as an outpatient. And some plastic surgeons perform these operations in their offices that are approved for use by usually one of the oversight surgical outfits that go around and examine surgical centers. And we in our office do it at one of the outpatient surgical centers that are close by, but that are run by a group of people that have a lot of experience in running surgical centers, and they're used by multiple surgical specialties and perform a lot of outpatient surgery. But it's, again, usually done under general anesthesia. The patient's asleep for about 2 hours, and then they go home about an hour or so after that. The recovery usually is about a week of restricted activity in terms of shoulder activity. And at that point, if they feel all right, I think the quicker they respond and get back into their normal way of doing things, the better they tend to do. Surgery does have its complications, and things can slow us down, and we would rather explain things that can happen and have them never happen, hopefully. But if they were to happen, the patient needs to know that the surgeon involved is doing his or her best to try to get them over that complication, and not ignore the fact that those things can happen. There's no surgery that can be done of any sort that isn't risky in some way and has its own aspects of complications. And so much of what you learn when we go through a surgical training program is basically how to try to avoid complications, but if they do occur, how to deal with them. In terms of choosing someone to do it, breast augmentation is done by persons other than plastic surgeons. We think as plastic surgeons that we've been through a training program that makes us well qualified to be the ones to go over things like this operation and to do the operation. And when the operations are done in facilities where their privileges have to be given, you have to show that to those facilities that you had the prerequisite training to do the surgery, and plastic surgeons over the years have been the ones that have done this type of surgery, I think, more commonly than other surgeons. But it's, in my judgment or recommendation, would be to check with your local medical society or friends or the American Society of Plastic Surgeons or the American Board of Plastic Surgery in terms of deciding who to go to see to consider this surgery. We would be glad to see you here at North Carolina Plastic Surgery. We have 3 plastic surgeons who are all board certified by the American Board of Plastic Surgery, who are, I think, very capable of going over with the patient who's thinking about having breast enlargement and talk to them about it, and then if they were to decide to go about doing it, trying to do it as safely and do it as well as possible.